All right, and we are live on YouTube, and we can get started.
All right, Erin, did you have anything you wanted to review with any of the Zoom
Oh
logistics
yeah,
for everyone?
thanks. We're in total like webinar mode here today. Yeah, so as people continue to come in, we're just kind of giving a minute for all of our participants to get going. This is the ASD webinar series, part 2. We are doing this in the webinar format on Zoom. So you can use the chat to put in any questions in. You can also use the Q&A. Either way, we'll be monitoring the chat and the Q&A to get your questions. Just as a reminder, if you haven't used the webinar format before, it's only the panelist who you're going to see during this, so every participant will be muted and their video will not be used, so don't worry about that. If you haven't gotten out of your pajamas yet today, that's okay. All right, and anything else, just let us know if you have questions. Thank you.
Great. Well, thank you everybody for joining us today. This presentation will cover the next steps, the pathway to services and supports for a child recently identified with autism. My name is Nicole Burning. I work as the Autism Clinical Lead at the Minnesota Department of Human Services. And now I'm going to let a few of my colleagues introduce themselves before we get started here. So Kim, would you like to introduce yourself?
Hi, I'm Kim Hicks, and I'm the EIDBI Policy Lead with the Department of Human Services.
I'm Erin Farrell. I am the ASD specialist at the Minnesota Department of Education.
And Elise, did you want to introduce yourself?
Yes, I'm just trying to get my video to work here. My name's Elise Holmes. I work with the Minnesota Department of Health as our early childhood specialist.
And good morning, everyone. I'm Dr. Jennifer Hall-Landy. I work at the University of Minnesota Institute on Community Integration, and I work in autism and early intervention. Thank you so much for joining us today. And with that, I will give a little bit of background. We are the Autism Interagency Team, or the Interagency Support Network. It's a group of us from various state agencies such as Minnesota Department of Health, Minnesota Department of Human Services, Minnesota Department of Education, DEED, and the University of Minnesota, all working together to collaborate and coordinate services, really to have a better services and supports for families in Minnesota. So we're the group presenting to you today, and thank you again for joining us. And I'll start, next slide please, Nicole, with our agenda for today. We are going to be covering a variety of topics around autism and early intervention. We'll be answering questions such as, what is autism spectrum disorder? Why is a medical or clinical diagnosis important? How can you manage challenging behaviors and help build your child's skills? Where do you go to access services and supports? Who else can help support you? And at the end, we'll have a discussion time and your chance to answer questions. Thank you. So I'm going to start a little bit talking today. We're going to talk both about clinical diagnoses and educational eligibility around autism spectrum disorder. So I'm going to cover the part around clinical and medical diagnosis. The first question, what is autism spectrum disorder? It's a neurodevelopmental disability, and we really have a few areas that we really talk about. 1, differences in communication. 2, social interactions, challenges with social interactions and developing relationships. And 3, restricted behaviors, repetitive patterns, interests, or activities. Next slide, please. I'm going to go into a little more detail on that. So really, we talk about core symptoms. Again, as I said earlier, and I'm going to talk a little bit about just the clinical diagnosis piece as we talk about the Diagnostic Statistical Manual, which will be my next slide. But we talk about deficits or challenges in communication, specifically social communication. Also, the presence of fixated interests and repetitive behaviors. I'm going to talk more specifically about that in just a bit. Next slide, please. So this next slide again talks about the Diagnostic and Statistical Manual. This is what we use to diagnose in clinical and medical settings. And we talk about it similar to the slide earlier, that we view autism spectrum disorder with two core domains: challenges in social communication and social interaction. That may be things like social and emotional reciprocity, the back and forth that we see in those early years, nonverbal communication such as gestures, and developing, maintaining, and understanding relationships. Two, the presence of restricted or repetitive patterns of behavior. Those may be things like repetitive motor movements, such as flapping, or insistence on sameness, routines, and rituals. That's the rigid part we talk about. Sometimes fixated patterns of interest. Sometimes children with autism have very strong fixated interests on one topic, maybe something like trains or vacuums, weather. We'll talk more about that in a bit. And then sensory issues, sometimes overreactive or underreactive. Next slide, please. Again, some additional characteristics that we see, and since we're talking a lot about early intervention today, in very young children, the first symptoms can occur very early. And a few of the first signs that we see, sometimes, and one of these alone isn't necessarily something to worry about. We talk about it as a constellation or a group of symptoms, but limited eye contact or limited ability to regulate eye contact, limited gestures. When children are little, we expect a lot of pointing, clapping, use of their hands, sort of some of those precursors to language. No response or inconsistent response to name can be one first sign. Limited interest in sharing or playing with others. Limited speech is a presenting concern. Again, limited speech on its own does not mean a child has autism, but it is one of the presenting concerns we often see. Also, loss of speech or a regression in speech. And again, delayed speech or no social babbling can be something that you want to talk to your healthcare provider about if you're seeing one or many of these signs. Next slide, please. So at the University of Minnesota, I help co-lead a project on autism prevalence. And I often get a question, how common is autism in Minnesota? Just a quick statistic here. In Minnesota, we estimate, based on data collected in Hennepin and Ramsey counties, that about 1 in 44 children, we look at 8-year-olds, have been identified with autism in Minnesota. If you want to learn more, the Minnesota Autism Developmental Disabilities Monitoring Network up in the right-hand slide has a wonderful website with lots of information. But what that sort of translates into is about 2.3% is the average estimated percentage in Minnesota of children with autism. Next slide, please. So we always want to share resources with you, particularly free resources. If you Google Autism Navigator and Baby Navigator, there are free online courses. They're free to the public. Certain portions of them are, and they're for families, professionals, or anyone interested in learning about autism, particularly in the early years. 18 months to 24 months of age. What we say is that with a lot of specialized training, certain clinicians, psychologists can identify autism as early as between 18 and 24 months. And the Autism Navigator talks a lot about that and talks about some of the early signs that parents can look for, as well as how they can support their child's development. So take a look at that. It just has a lot of resources and tools to support your baby's early learning and early social communication. Next slide, please. Another free resource, if you Google CDC's, the Center for Disease Control and Prevention's Learn the Signs, Act Early. Again, that's Learn the Signs, Act Early. There are a wealth of free resources, both to monitor your child's development, really at any time between birth through 5, but also things like an autism case training. That is a free, again, course that you can take from the comfort of your home. And it talks a lot about autism, identifying early autism, and just talks walks you through some cases in terms of early autism identification. Next slide, please. Another free resource are the ASD, that means Autism Spectrum Disorder Strategies in Action. You can get the Autism Certificate Series. It's a wonderful web-based course for families, educators, providers, professionals, anyone who wants to learn more about autism. And you can contact this website here, asd.dhs@state.mn.us for a free subscription. It's a great course. There are just many resources that you can take. Next slide, please. Finally, we get the question a lot, why is a medical or clinical diagnosis of autism important? And what we tell families is both the clinical or medical diagnosis and the educational eligibility in the local school district play an important role in evaluating your child's progress and determining supports that they're eligible for. So when we talk about a clinical diagnosis that you get in a clinic or medical office, it really, once you get that, it really helps open the door in terms of other types of services like medical assistance, Social Security, waiver-based services. So we really encourage families to have an open dialogue with their healthcare provider during well baby visits to really talk about some of the signs you're seeing, really get referrals if needed for additional testing, and really be well connected with a lot of the resources we're going to share today about how you get those early intervention services and supports. With that, I'm going to turn it over to my colleague from Minnesota Department of Education, Erin, who's going to talk about the importance of the educational eligibility in autism spectrum disorder. So thank you, Erin.
Yeah, thanks, Jen. So we're really proud of the work that we've done and the documents that we've helped to create to help guide you in this. And that's what this webinar series is really all about. But in education, you know, we and in medical as well, there's some confusion with, well, what's the difference between, you know, having a medical diagnosis and determining educational criteria or educational eligibility? And they are very different because they help you to access different services. And so you can have one or the other and access services through the means of either the medical or educational way that you're pursuing whichever eligibility. But what special education eligibility is going to provide for you is really targeting at, you know, what are the educational needs that the student has, and what are the educational supports and things that we can put in place to help keep them successful educationally. And so what an educational determination really helps to find is what supports do they need in school to help support them educationally. And the medical is different, that it's going to provide, like Jen said, all sorts of other services and access to things outside of just the educational world, because we know that that autism is something that it's 24/7. And so it's really important to look into, you know, what the supports are that are right for you. So on the next slide,
and I think maybe if we could just help address some of the questions too,
sure.
while Jen is still on the line. So Jen, there were just some questions around the tools to diagnose ASD, and then maybe some questions around how providers and schools are no longer testing for kids under the age of 6. So just maybe if you wanted to help address. And I know there was a question about receiving the PowerPoint presentation. I think, Erin, you'll send that out to everyone who registered.
Sure. Nicole, would it be helpful if I went into the chat and looked and let Erin continue presenting and I can take a look and answer some of those?
We can definitely try if you want to just type the answer, and then, yeah, Erin, if you want to address the,
okay. Yeah,
the slide.
through. That sounds good.
Yeah, and some of the questions, so we can talk about some of the specific things. Looking at their districts are doing things differently, but ASD is definitely something that it is not only determined at age 6. So that's something that we can talk about in different districts, and in the practice. We want to determine ASD eligibility as soon as possible, because really that helps us to have the conversations so that families are able to access the services within the school environment as well as outside of school. So there is nothing that says that it has to be age 6 or older. So what happens with the educational determination is that your child will go through an evaluation process. And as a parent who has gone through this process with my own child, you know, it's different as a professional than it is as a parent. And sometimes, and so it's just really helpful to know what these things are. So the process educationally is really just to help determine the educational needs, like I said. And the team will then work together to create either an IEP, an individualized education plan, or an IFSP, an early childhood individualized family service plan. And this will really show what your child needs and address specific things and supports that we can put in place within the educational environment. It could include speech and occupational therapy and other services. It may or may not, but you can access both medical and educational services. They are not mutually exclusive. So we can go to the next slide. So the pathway to services, I believe this is where Nicole is taking over. And so I will turn it over to Nicole. Oh, no, it's not. I'm sorry. I'm still talking. I'm sorry. I'm looking at the slide. Okay. So like I said, with the educational determination and the medical, this document really helps to show the different pathway to services. So you can access services through, having that initial conversation with your primary care provider, through accessing services in early childhood. And we have the information for Help Me Grow on there. And that really shows helps you to look at how you can access services at no cost to you, and regardless of where you're at in your journey and trying to get support and services for your child. There's also different things that we have. Nicole's going to talk about later, the EIDBI benefit. And we really want to make sure that, the reason that it's really important to have these conversations as soon as possible, and as soon as we're seeing those signs that it could be autism, is it's not just that it gives you a diagnosis or a label. It's that it really helps to connect you to a community, and that's what we really want to help support too. That through having the conversation around autism, you're then accessing services and supports and people who also have a child on the spectrum, possibly, or a family member, and can help you kind of see what some of the different pathways are. So if we can go to the next slide.
Yes, and it just does sound like some people are having a little trouble seeing the Q&A questions, and so I just wondered if we wanted to try and address the question around the screening tools quickly before we move on. Jen, if you just wanted to share, I know that the question in there about the SE and the strengths and difficulties questionnaire, those are not screening tools used to determine an ASD diagnosis. Those are just to determine a level of intensity for services that some providers are using. I don't know, Jen, if you wanted to just speak to kind of what are the recommended.
Sure. Yeah. And thanks. And I'll do it quickly, Nicole, before I hop off to run.
Sorry. Yep.
And I'm not seeing all the questions here, but I'll answer what I really is a best practices assessment in terms of autism. And obviously, a lot of these things have been adapted right now due to COVID. But what you will see in terms of the gold standard, both in clinics, but often in schools too, is when we do an ADOS, or Autism Diagnostic Observation Schedule. And that is where we construct a social environment within a clinical setting. It's standardized. We observe the child. We also use tools such as the ADI, which is the Autism Diagnostic Interview, again, standardized, where we walk through with a parent about developmental history and really understand what that was. That really is a key part of autism. We also like to do cognitive measures, adaptive measures, really a full set of standardized tools. Things like the ages and stages really is a screener that is super helpful during well-child visits, as is an MChat for an autism screener, where it helps us see, are there some signs that merit further testing. But if you come to most clinics, you're going to get a very comprehensive assessment using, again, this is prior to COVID, direct observational tools, parent interview, developmental history, cognitive, adaptive, behavioral measures. It's really quite a comprehensive and thorough assessment process. I'm happy to answer more. I think we'll share our emails at the end if anyone wants to reach out to me. But please feel free to forward any additional questions. Thank you so much, everyone, for joining. And team, I'm going to hop off now. Thank you.
And I do see there were some questions just around how some of the screenings and testing and different services are being provided during COVID. And we do have some slides on that. So we'll probably just hold off on those questions.
Sounds good. And what I'd like to do, I do see a lot of questions coming in, and this is great. A lot of them will be answered, so I would really like to just keep going through and maybe at the end do the questions and answers, because there's a lot of different things that are coming in that we will answer your questions throughout this. So maybe if we can hold other questions until the end, and then just really get through those at the end, because I think as all these questions are pouring in, they're great ones, and that's what we're here for. And I think that we will be addressing a lot of these as we're going. So, okay, so where do you go to access services and supports? So really that's what we're trying to do, is to bring all of these state agencies to the table that really are helping to provide a lot of these services. And so this is a really wonderful helpful document to look at as you're trying to navigate this. So you can absolutely access services through educational services. You can also access them through that medical diagnosis. We also are going to talk about in this and other webinars how you access long-term services and supports, early intervention services, and transition. So this is not a straight pathway. As you see, you can enter this at any point through either the educational services or the medical diagnosis. And everyone chooses their own journey on this. So it really is, it's up to you and how you want to access these services. But educationally, we provide support services that are going to help your student be successful educationally. And that medical diagnosis helps you to access those services outside of the educational or the school day, and to really get around any services that you might need outside of that. If we can go to the next slide. So here are some things. So some of the questions that are coming in, the education portal, the Minnesota Autism portal, there's a wealth of resources and supports on there for education. So you can access things through the Minnesota Department of Education website. And I actually have another slide with some other resources on there. And through Help Me Grow, and this is the number to call if you would like to get services through that. You can also access supports and services through early childhood special education. Go on the next slide. So again, through educationally, you can access a lot of different services. They may or may not include. Now, this isn't for everybody. This really depends on the needs of the student and what they are eligible for. But you might have some supports with assistive technology. You might have some supports with speech therapy, any academic supports, occupational therapy, physical therapy, vision and hearing. These are all things that could be included in either your IEP or IFSP, and are also accessible outside of the educational services if you so choose as well. And the next slide. So this is just a really, so Jen talked about the prevalence across the state of Minnesota, and this is what we see educationally. So these are the students who are accessing special education services. And you can see from 2006, 2007 school year till last academic school year, we've increased this is the percentage of students identified with autism spectrum disorder and are receiving services under autism spectrum disorder. It's the percentage of special education. So this isn't of all students. This is the percentage of special education students receiving services under ASD. So we've gone from 8.2% to 14.2% of the students that we serve in special education receiving services under ASD. So it's quite a significant increase over time, and you can see it's not increasing all that much in the last couple of years, but we haven't stopped. We're hopeful that we're identifying more students that are needing those services, and we're still working to make sure that we are identifying everyone that we can who needs services. Next slide. So these resources should answer some of the questions that have been coming in. So on the Minnesota Department of Education website, when you go to that, the first homepage that you see, it shows COVID-19 updates. And so you can go to that and you can see all of the COVID-19 updates for education in general. There is a special education COVID-19 resource page, which is a resource for families, educators, and any due process guidance. There you can see, you can also see links to safe learning plans. These are updated regularly. I believe when I checked last night, the last update was on Friday, I think. So they are updated very regularly, and this is where you can really find up-to-date information. So this and some of the information that's put out, I think there was a question about how kids are receiving services through COVID-19, and that really varies by your district. But if you look on there, it does, we do have, guidance out that really we're working to prioritize in-person services for students on IEPs and receiving special education services. And so what that looks like can vary by district because there's not really a regulation on exactly what that needs to look like. But there is some support and guidance for that. Next slide. And then I think Tammy was going to talk about this one.
Yes, hi. Thank you for covering that, Erin. And I know that when we talk about a free and appropriate public education and least restrictive environment, it's kind of hard to think about during the time of COVID. So I appreciate that the Minnesota Department of Education has these updated pieces of guidance for us. But I just wanted to make sure that everyone knows that if your child does qualify educationally, the Individuals with Disabilities Education Act, IDEA, is a law that requires the school district to provide what's called a free and appropriate public education to your child. And what that means is that it ensures that your child is able to make progress in the educational environment. And you will have what's called an IEP, as Erin mentioned, that would be an individualized plan to help your child achieve that. The other part of the law that I wanted to make sure everyone knows about is the least restrictive environment. So this means that for your child, the services should be provided in their least restrictive environment with whatever aids or supports that they need. So I think this is important to know because we really want kids to be able to be educated with their same grade general education peers.
Thanks, Tammy. And I think now we're going to turn it over to Elise.
Great. So I know we had mentioned a couple of things in the last webinar, but for those that weren't able to make it, a little bit of a difference, again, between from the medical standpoint when we're doing screening versus when we're doing diagnosis. So first, to really talk about screening, screening is a tool that just kind of helps point us in the direction of something that might be a little bit different than your average child's development. So then we can take a closer look through an evaluation and then get a diagnosis. So these sorts of tools, sometimes known as it'd be an ASQ or a ages and stages questionnaire. And there's a number of other tools that a pediatrician, a family home visitor, someone from local public health might use to screen a child for ASD. And so there's some information on the MDH website and as well as through Child and Teen Checkups program for any sort of providers that are looking at what the requirements are for screening at those different well child visits. So, we have each of those well child visits you have from when your child's a baby up through as they develop. And each of those appointments has some recommended screening that should be happening so that we could pick up anything that might need a closer look. So recommended screening that's very specific to ASD, we want to be occurring at 18 and 24 months. That's what the Department of Health and CDC recommend that providers use. And then additional other developmental screening that also can point towards autism although it may not be, autism specific. And then after that screen, if there was something that either the parent themselves or the provider or both are concerned about, then we would look towards an evaluation. And again, last time we talked a little bit about how, that evaluation can sort of happen in a number of different ways. One place that can happen is through a licensed mental health provider with a comprehensive multidisciplinary evaluation. And so Nicole mentioned how, especially if you're looking for Medicaid services, then that would be something you would need to pursue to be eligible. Now, when you have that medical diagnosis of ASD, that is where you would potentially be eligible for Medicaid services if you were not already income eligible. So again, if there are additional questions about that, we can certainly address those. If you want to go on the next slide. But in general, in terms of our healthcare needs and pursuing a full comprehensive evaluation, we mentioned meeting with that licensed mental health provider to get a diagnosis. We also work through other channels in the medical sphere to pursue a diagnosis. And some of those things can be a really kind of comprehensive medical evaluation that might look at if, especially if your child is having seizures, if they're having a lot of sleep disturbances, trouble eating, then those sort of things, they can really point towards what sort of treatments might be most helpful. But the other thing that we want to consider for any sort of child with autism or, is suspected of having autism but doesn't have a diagnosis is that recognizing that behavior is communication, and therefore knowing that children with autism may have difficulty communicating things like pain or any visual disturbances or things that might be going on, it's really important to talk to your doctor and have them do some good evaluations around their hearing and vision, making sure there's not any injuries, tooth pain, sleep apnea that might be happening. It's really common to have some GI or gastrointestinal issues. So before necessarily pursuing a lot of diet changes or a lot of other things, it can be really helpful to talk to your doctor just to make sure they can give you a little bit of guidance on that. And then if I know this happens occasionally, and there are some really phenomenal pediatricians and family practice docs out there, but if for some reason your relationship with them is not going super well, or you feel like you're voicing these concerns and they're not being listened to, you can always ask them directly for a referral. You have to see what you might be eligible for, but you can just ask, I would really like to be referred for an evaluation, or I'd really like a referral for their GI issues. So always feel comfortable trying to raise that, even if your doctor's sort of unsure or hesitant. But again, there are some great ones out there that can be really helpful. You want to go to the next slide? And as I kind of mentioned, there's a number of different treatments you might pursue related to autism. So depending on the various needs that the child or adult may have, some sort of physical or speech or occupational therapy, any sort of hospital care, or medication management for sleep disorders or seizures. The other therapy that I'll mention here too is a number of children also can benefit from mental health or behavioral therapies. And so those can also be really helpful and accessed potentially via your primary care doctor or your typical health system. Go to the next slide.
Great. So I will take it over from here. So we just wanted to share a few other resources that may be helpful, especially if you're looking at trying to help manage any of your child's behaviors at home right now, or work on some skill building at home. So we really do encourage, there are a lot of those trainings and resources that are available. We do have some videos. All of these are always found on the Minnesota Autism Resource Portal website, which we'll have the link to here at the end. But one of those videos, we have a video series that are called on the Autism Spectrum, Families Find Help and Hope. And you can hear from several different communities in Minnesota. And these are families that live right here in Minnesota and have really experienced the system and talk about their journey from receiving a diagnosis all the way to accessing those services and supports. And so you'll hear from the African American, Hmong, Latino, Native American, and Somali communities. And so these can be really helpful videos to share with any families in those communities that may be experiencing some additional questions and concerns. And they are all in, they're translated, they're all in the language that those communities speak. And so families will be able to access all of that information. And they're only about 15 to 20 minutes. So again, a nice resource to share, sit down and share with families. We also have one on telemedicine supports for families. And this was a training recorded session that just helps supports family at this time. We all know that everything has really moved to that virtual setting, and just talks about how a family can kind of adapt some of their services to that more telemedicine format. We review things like the required technology, how to set up your environment for these sessions, some of the programming that you could be, likely successful working on with any of your providers, or a primary care physician, or whoever that might be, or the school district. So just some suggestions there, and just how you can help to make sure that this really is very person-centered and tailored to your family and your child specifically. So again, that's a recording that's available. And we also encourage you, we have a Minnesota Autism Portal Facebook page, and we're always posting the latest like webinars and resources and things like that, that during this time that can just help you with finding those different resources and support. So when you're going through that next steps document, whether you're a case manager or a school district provider working with a family, or the family, if you're reviewing it yourself for your child, we hope that it does break things down very step by step for you about those next steps that you take to access the services. So again, we always encourage you to get connected through those educational supports. So if that is a child birth to 5, that would be through Help Me Grow Minnesota. If the child is over 5, obviously contacting the school district directly, and then looking for that comprehensive evaluation to access those early intervention services. And we really recommend starting with the Minnesota EIDBI 101, and I'll talk about EIDBI here in a second, but that can also help you find a provider, request an evaluation, and those services are provided more either in your home or in a community-based setting. So just another additional option for services and support. And of course, you always have that connection through your local county or tribal office, and they can be very helpful with any of the financial resource questions about the Min Choices assessment, anything like that. And you'll see on the form, it has a space where you can write in the date that you called, who you talked to. If you did set up an evaluation date, you can record all of that there. So just a nice option to keep all of that information in one place and organized. As far as the eligibility and healthcare coverage options, we do encourage you to visit the minsure.org website, and that will just walk you through what you might be eligible for. We do always want to remind people that if a family, if their income is too high and they're not eligible for straight Medicaid services, that there is the TEFRA option. It may require that parental fee, but it does open up the door to some of those additional services that are available through Medicaid. And if you do have any other additional questions, contacting your county agency or tribe and your health plan member services. So if you're part of a prepaid health plan, and always you can contact the member help desk through DHS if you're already a Medicaid enrolled member, and they can help walk you through those additional options, find out what services you're eligible for, help locate a provider, those types of things. We do also encourage you to ask about case management services. That can be really helpful to help coordinate all of these services and supports, find providers, contact them, see who has waiting lists. All of those types of things can be really helpful through the case management. And keep checking on some of the other on-demand webinars. We do have one available through the Family Voices of Minnesota on healthcare coverage and EIDBI specifically. So you'll see that through those links as well. And then on the forum, we're going to walk through what to do over the course of the next few months. So once you're in contact with your school district, you'll be developing that individual education plan or a family service plan, depending on the child's age. Again, and just keeping track of the date of that, because you will need to have that updated regularly. And then scheduling that appointment to develop a treatment plan with your early intervention provider, if that's another resource that you're going to utilize at this time. And I think what we really want to stress with having these interagency webinars is that it doesn't have to be an either or type of plan. You don't have to just go down the educational service route or just through a community-based provider. You really can be accessing all of these types of services together. We really would like to see children receive that holistic approach to treatment services across this multidisciplinary basis of providers. And then we just encourage you to also, if you were put on a wait list, or if you are waiting for additional testing or any evaluations, that you're following up on that with those providers. And then really by the end of the first year, looking at updating those IEP plans. We do also have resources online about thinking about what goals you would like to work on, what might be important for you and your child and your family to be working on, and that you might want to advocate for. And then looking at continuing to update your treatment plan for your early intervention provider, follow up with the local county or tribal office. That MinChoices assessment, it is required to be updated yearly. So that again might be something that you need to schedule that update and make sure that you're schedule that appointment so there isn't any lapse in coverage of your services and things like that. And then just making sure that you are following up with your primary care provider for your next well-child visit. So any of those resources that Elise talked about could be available to you as well. And then just helping to address if there are any other concerns that are new behaviors, share that information with your primary care provider and talk about, what might need to change or be adjusted as far as the plan there. So just to talk a little bit more about EIDBI, so that does stand for the Early Intensive Developmental and Behavioral Intervention, or EIDBI benefit. And again, as I said, these services really provide those early intervention services in the home or in a community-based setting, so whether that be a clinic or a center. And they really help to address those core deficits of autism. So working on teaching the child functional communication skills, helping to build those relationships, interact socially, and just really help them build some independence, develop some self-care, safety skills, those types of things. So obviously the child would take that comprehensive evaluation to determine if this is something that is medically appropriate or necessary for them. We do stress that comprehensive evaluation could qualify as a medical diagnosis. So a child doesn't already have to have a diagnosis in order to access EIDBI. They could be receiving that as their initial diagnosis. And although it is intensive, it is built into the title there. There are some exceptions to that intensity level. So not all children are receiving, the 20, 30, 40 hours a week. Some, it may be appropriate for them, but some children we see an average of 10 hours a week or even less than that. So this could be something that they also receive in conjunction with educational supports, or maybe they're, seeing a speech therapist or occupational therapist, but also receiving some of this EIDBI support as well. And of course, all intervention is either one-on-one with a direct therapist or in a small group setting. We do also have several of our providers are offering telehealth services at this time. So this is something that is continuing both in person and via telehealth during COVID right now. So we just, stress that this is something you can still reach out to these providers and request that evaluation. And we are also seeing providers offer just the family caregiver training and counseling portion of these services. So that can be really helpful. The child doesn't even need to be accessing the direct intervention service. They could just be assisting and providing support to the family or the caregiver just to help them work through some of these behaviors or help with that distance learning. They can help address some of the attending issues, just manage any of those behaviors around distance learning at this time as well. So eligibility is birth up to age 21. We see children with autism or related conditions. And of course, anyone on medical assistance, which includes TEFRA, prepaid health plans. We do also see some private insurance companies that will cover EIDBI. So hopefully no financial coverage would be a barrier for the child. And those related conditions, so anything severe and chronic, similar symptoms to a child with autism, and just appropriately responding to therapy in a similar way. So we do see things like ADHD, oppositional defiant disorder, fetal alcohol spectrum disorder, things like that. Other eligibility, other ways that they could be eligible for services if they are just displaying risk factors for ASD, things like prematurity, any older siblings that may have a diagnosis of autism, any presence of that intellectual disability or a language impairment, just maybe demonstrating some of the signs and symptoms of autism, but not yet fully diagnosed. We would still, like the child to get in and get access to those early intervention services and supports early on. And we always just want to stress that anyone can make that referral. So if you're a parent or caregiver, you can call the provider directly. You can work with your case manager. Any school providers can help a family to access these supports as well. So really anyone can help a family access these services. And we encourage everyone to take the EIDBI 101 online training. There is a version for providers, and then there's one for kind of families and lead agencies and those that support families. It is also available through TrainLink, but those other links there, you don't even need to log in. You can just access that. And then we do have a resource that goes through the providers and how to find one in the community. So currently we have 131 EIDBI agencies throughout the state of Minnesota, and you can find all of those in the directory, and I have all the directions there on how to access them. And then I will turn it over to Kim.
Thank you so much, Nicole. So we're going to talk a little bit about how EIDBI looks a little different during COVID-19. Our EIDBI providers are still allowed to utilize telemedicine and in person when safe, to complete evaluations, do diagnostics, and provide early intervention services. Many of our services are available via telehealth, and we've heard good reports from families about the ability to access particularly family caregiver training via telehealth as a wonderful resource during this difficult time. There's also a list of COVID-19 resources on the Autism portal, and that link is included in the PowerPoint here for you as well. And Erin put some of these in the chat too, but there's also the Distance Learning and Disability Services Guide and the Case Manager Guidance for Distance Learning as well. Next slide, please. When we talk about the next steps after a child receives a diagnosis, we've said this before, but it's not a one path option. It is whichever path or paths make the most sense for that individual child. So again, educational resources, contacting Help Me Grow or your local school district, early intervention services, contacting your local tribe and using the provider directory to find a CMDE or EIDBI provider, or following up with your primary care provider to learn about other options, supports, get appropriate referrals for other specialists that may be appropriate for your child. Next slide, please. When we talk about getting a diagnosis, it can be so overwhelming. And so identifying all of the supports that may be available to support your family can be very helpful. There are support groups available and other advocacy information through Family Voices, the Autism Society of Minnesota, and also on the Autism portal, we have a list of support groups that we're aware of. If by chance you're on this call and you're part of a support group that we don't have listed, please send us an email at asd.dhs@state.mn. So that we can get that added to the website. There's also the ARC of Minnesota and PACER. and additional advocacy organizations listed on the portal as well. Feel free to explore those links to find the right resource for you. Next slide, please. We've recently created a guidebook for parents and caregivers. The PDF is here attached, but it's also in the upper right-hand quadrant on the Autism portal. And this guidebook really talks about questions about development. All the different steps and links and these documents that we've been sharing today are listed there as well to help you move forward after a diagnosis. Next slide, please. Just some tips from one parent to another. Start a list of important people in your child and family's life with their contact information and what they do to support you, how they can help you, and who you would call for what. Sometimes when we get into this world, people use the same category to describe themselves. I don't know how many case managers I've met, but they don't all do the same thing. And I don't always remember who can help with what. So creating that list can be so helpful. Also, a tip is to create a binder. Keep copies of any forms, assessments, summaries of appointments, summaries of home visits or other important documents, so that if you're asked for some information, it's all in one place and it's easier to find. Consider organizing by service or provider so that you're not just flipping through. Next slide, please. And we shared this resource earlier, but this is on the autism spectrum, families finding hope and help. These YouTube videos can be very helpful just to see how other families' journeys have gone and reflect on how that may be beneficial for your family. Next slide, please. And this is the portal that we've talked about so very much in this presentation. So you can see the entire portal here, and up on the top of that screen where it says Pathway to Services and Supports, if you click that link, all of the documents we've shared today are under that link. Next slide, please. All right, well, we will open it up to questions at this time.
So what I'm going to do really quickly before we open it up to questions is I'm actually going to stop the streaming. So I just want to thank you to everyone who's here today, and all of our contributors, all of our participants. Thank you to all of my colleagues who are here.